Hello everyone, welcome to HeInfo. In today's video, we'll be diving into an important medication, Fosamax, also known as Alendronate. Before we talk about the medicine itself, let's briefly touch on some key conditions that Fosamax helps with: osteoporosis and Paget's disease. Osteoporosis is a condition where bones become weak and fragile, making them more likely to break. On the other hand, Paget's disease is a condition where bones become enlarged and misshapen. Both conditions can severely affect bone health, and managing them properly is crucial for a better quality of life. So, how do we manage these conditions? That's where Fosamax comes in, and that's what we're going to talk about today. What is Fosamax? Fosamax is the brand name for Alendronate, a medication that belongs to a class of drugs called bisphosphonates. It works by slowing down the breakdown of bones, allowing them to stay stronger for longer. Fosamax is primarily used to treat and prevent osteoporosis in both men and women, particularly in postmenopausal women who are at a higher risk for bone fractures. It's also used to treat Paget's disease of bone, a condition that disrupts the normal bone recycling process. Additionally, it may be prescribed to treat osteoporosis caused by long-term use of corticosteroid medications. However, Fosamax isn't suitable for everyone. If you have certain conditions, you should not take this medication. For example, it is contraindicated if you have a history of esophageal problems such as narrowing or difficulty swallowing, or if you have low blood calcium levels, hypocalcemia. It should also be avoided in people who cannot sit or stand upright for at least 30 minutes after taking the medication. The typical dose of Fosamax for osteoporosis in adults is 70 mg once a week or 10 mg daily. For Paget's disease, a higher dose of 40 mg daily for 6 months is typically prescribed. It's very important that you take the medication exactly as prescribed to avoid serious side effects. Always take it first thing in the morning with a full glass of water, and wait at least 30 minutes before eating, drinking, or taking other medications. How does it work? Fosamax works by inhibiting the activity of osteoclasts, the cells responsible for breaking down bone. By doing so, it slows down bone resorption, allowing bone formation to catch up, and helping to maintain bone density. This makes the bones stronger and less prone to fractures. Like any medication, Fosamax can have side effects. Common ones include stomach upset, heartburn, and mild bone, joint, or muscle pain. More serious side effects, although rare, include esophageal problems, osteoporosis of the jaw, a condition where the bone tissue in the jaw dies, and unusual thigh bone fractures. If you experience any of these, make sure to consult your doctor immediately. Now, let's take a look at the pros and cons of Fosamax. Pros. It helps prevent bone fractures by maintaining bone density. It's generally well tolerated and can be taken just once a week. It has been shown to effectively treat osteoporosis and Paget's disease. Cons. It can cause gastrointestinal side effects, especially if not taken properly. It's not suitable for people with certain health conditions, such as esophageal disorders. There's a risk, although low, of more serious side effects like jawbone issues and fractures. Let's now address some frequently asked questions about Fosamax. Why is Alendronate, Fosamax, taken once a week? If you're taking Alendronate, Fosamax, for the prevention or treatment osteoporosis, your provider can prescribe it either weekly or daily, depending on the dose. The weekly dose of Alendronate, Fosamax, is higher than the daily dose. Studies comparing Alendronate, Fosamax, weekly and daily dosing show that there aren't any major differences between how well either dosing worked to treat osteoporosis, nor in rates of side effects. But people generally preferred the weekly dosing because it's more convenient. If you've questions about either the weekly or daily dosing, talk with your provider. What if I miss my once-weekly dose of Alendronate, Fosamax? If you're halfway through or have already finished breakfast and realize you forgot to take your Alendronate, Fosamax, wait until the next morning to take your dose. You can go back to your regular schedule the following week. Never take a double dose to make up for missed doses. Does Alendronate, Fosamax, cause weight gain? Weight gain isn't a common side effect of Alendronate, Fosamax. If you notice a change in weight while taking this medication, talk with your provider because it might be because of something else. What should you do if Alendronate, Fosamax, causes joint pain? Joint, muscle, and bone pain are common side effects of Alendronate, Fosamax, that can occur within 1 day to several months after starting treatment. If your musculoskeletal discomfort is short-term, your provider might recommend an over-the-counter OTC pain medicine like acetaminophen, Tylenol, to take as needed for joint, muscle, or bone pain symptoms. If your musculoskeletal pain is severe or long-lasting, this could be a sign of a fracture, so get medical help right away. That's a wrap on Fosamax. It's an effective treatment for osteoporosis and Paget's disease. But it's important to take it as directed to avoid any potential side effects. Remember, always consult your healthcare provider if you have any questions or concerns about your treatment. I hope this video helped clarify some important points about Fosamax, and as always, thank you so much for watching. Stay healthy and take care.